I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to talk about peripheral arterial disease. We are going to talk about who gets it, what are the risk factors of getting peripheral arterial diseases, what are the complications of peripheral arterial disease, how do we prevent peripheral arterial disease, and what do we need to do to be able to prevent ourselves from getting a peripheral arterial disease. So peripheral arterial disease is a condition whereby the arteries that supply the blood to the limbs, either the heart or the legs, get narrowed or get blocked. This is more common in the lower limbs, and it is usually caused by atherosclerosis. As I've talked before, atherosclerosis is a process whereby there is a progressive narrowing of the blood vessels, and they form due to buildup of fatty deposits, and they build up plaques, and these plaques can either burst or rupture, and they can block the blood vessel. So the individuals who have peripheral arterial disease, they have increased risk of getting a stroke, and they also have increased risk of getting a stroke. So these are some of the warning signs that you may be at risk of getting a stroke or a heart attack. Peripheral arterial disease affects over 200 million people worldwide, and it increases with age. As you age, the risk increases more. It is more common in those who are over 55 years, in forming about 10 to 15% of those who have peripheral arterial disease. It is more common in smokers, people who have diabetes, and also individuals who have heart problems. So what are the risk factors for getting peripheral arterial disease? We have those risks that we can modify, and there are those that we can do nothing about. They are part of our genetic makeup. The modifiable risk factors that you need to be aware about include smoking, having hypertension, having diabetes, having high cholesterol or abnormal cholesterol, and also being obese and living a sedentary lifestyle. So there are those risk factors that are not modifiable over the age of 50. If you have a family history of peripheral arterial disease, or a family history of stroke, or myocardial diseases, or a heart attack, then you are at risk of having peripheral arterial disease. Of course, the presentation will include intermittent claudication, this is pain or clamping in the legs when you are walking or during activity. You may have numbness of the feet, you may have weakness in the feet, you may have coldness in the legs or feet. In severe cases, you may have non-healing ulcers on the feet or the toes. Sometimes you may have complete blockage of the blood supply of the feet. This will lead to loss of the peripheral passes in the feet. It will also lead to darkening of the foot. It may also lead to darkening or ulceration in the foot because there is complete blockage of the blood supply of the feet, and this can be very, very painful. So excessive pain in the feet could be a sign that you're having blockage of the arterial blood supply to your feet. So how do we make a diagnosis of peripheral arterial disease? Of course, we have the history and the examination. In the history, we are looking at the risk factors. Examination, we are looking at the peripheral passes. Are they weak? Are they absent? Then the test that you can do, you have ankle-brachial index, which is a measure of the blood flow to the lower limbs. You can do ultrasound and check the vessels, see whether they are blocked. You can do what we call CT angiography. This is a CT with a dye in the blood vessels, and this will show you how the flow of blood is in the lower limbs. Of course, doing an MRI of the leg can also be very helpful. So how do you treat peripheral arterial disease? One will include lifestyle changes. One of the biggest causes of peripheral arterial disease is smoking. So quit smoking, and then have regular exercise to improve your blood flow to your feet, and maintaining a healthy diet. Then medications, what we call antiplatelets, drugs like aspirin, clopidogrel, use of statins, these are cholesterol lowering drugs, and control of blood pressure. When you have blockage of these vessels, then surgical intervention might be necessary. You may have revascularization procedures whereby there is grafting of the vessel of the part that is blocked. You bypass it through surgery, and this could be life-saving. Of course, there is also trying to open up the clots using stents. You can also do angioplasty to help revascularize the vessels. So what are the complications of peripheral arterial disease? These include people who have peripheral arterial disease. They have a process of blockage of vessels everywhere. They may get stroke, they may get heart attacks. Of course, there is a loss of limb. The limb might get amputated because of the loss of blood supply. You may also have ulcers on the feet, and of course pain, and this could be debilitating. So if you have your limbs amputated, then this leads to loss of limb and leads to disability, and of course it affects it may have also emotional effect on the individual. So how do we prevent peripheral arterial disease? One is adopt a healthy lifestyle, which includes having regular exercises and having a balanced diet, which is rich in fruits and vegetables, high in fiber and lean proteins. Avoid smoking and limit your alcohol intake. Manage diabetes, hypertension, and high cholesterol. It is also good for those individuals who have hypertension, who have diabetes, to have the blood supply to the lower limbs always checked. Doing the blood supply test to check what is how is the flow in the lower limbs, and of course making sure that you have a regular scheduled visit with your doctor so that this can be done. So recognize that peripheral arterial disease is a common complication in people who have diabetes, hypertension, those who are smokers, those who have a sedentary lifestyle. And it is always good to have regular checkups with a medical provider so that you may keep yourself updated and you may get advice on how to take care of your health. I encourage you to subscribe to the Overall Health channel for more updates, and also share this information within your friends and circles so that all of us take precautions and maintain our health. Your health is in your hands. Your health is your wealth. Thank you for watching.